is not visible, go for targeted sonography, because it goes in favor of complete agenesis or partial agenesis of corpus callosum. Posterior portion of lateral ventricle, atrium and posterior horn, and posterior portion of the lateral ventricle, occipital horn. Already I covered during the anatomy. The transcerebellar, this is the anatomy of cerebellum, and I already covered the rule of thumb is by 19 weeks there should be no midline fluid filled space between the two cerebellar hemispheres. That means the vermis has already covered the area and there is a clear demarcation between cisterna magna and fourth ventricle. If it is present, may be associated with anomaly of cerebellar vermis and referred to neurosonography. Transthalamic area, the thalamic plane, these are the mostly we do the measurements. And if you go little bit slight caudal, the interpeduncular and ambient and quadrigeminal cistern along with the cerebral peduncles can be seen. Cerebral peduncles are midbrain. Now fetal spine has to be seen and to understand whether there is any problem with those three ossification center and intactness of the skin overlying the spine by transverse or coronal or sagittal. So this is, if you do a little bit detailed scanning, you can see the conus medullaris which at the L2 and using an ossified spinous process of vertebra acoustic window, contents of neural canal can also be seen. And this is the very important of transverse section of each and axial view of all level. The quantitative evaluation, atrial width, biometry and transcerebellar diameter increased by 1 millimeter per week. And this is the measurement, how to do a measurement of the lateral ventricle has been given in ISWA guideline. And this is the best way at where the parieto-occipital sulcus is there at mid gestation, and take the glomus and the lateral ventricle. A low risk mid trimester pregnancy. That is, it is a very important statement. If a low risk mid trimester pregnancy, if the transventricular, transcerebellar planes are obtained satisfactorily, the head measurement, head circumference in particular, are within normal limits for gestational age. The atrial width is less than 10 millimeter and the cisterna magna width is between 2 and 10 millimeter. Many cerebral malformations are excluded. The risk of CNS anomaly that can be diagnosed at this gestational age is exceedingly low and further examination are not indicated. That means if you do a good screening with knowledge of anatomy at a different stage. So screening examination of fetal brain before 18 weeks recommendation is that screening ultrasound examination is carried out before 18 weeks. Efforts should be made to visualize and document the transventricular and transcerebellar plane. Now this is again at 16 weeks what to be done, because we are reaching as early as possible to know whether the things are normal or abnormal or not. So this is the best way to know the anatomy and embryology. What is the targeted neurosonography? The targeted neurosonography focus in this guideline is to describe the protocol for diagnostic ultrasound examination that should be performed in any case in which there is an increased risk of CNS malformation. So there are multiple indications, and these indications have to be kept in mind while we do our screening examination. If there is a problem, we should go for targeted sonography, and the transvaginal approach is the best way. But if it is breech, then we can do a transabdominal also. So axial, coronal and sagittal planes as described part 1, these guidelines. So fetal vein, variety of scanning methods can be used depending upon the position of the fetus, and I have already covered all these anatomical plane, 4 coronal and 3 sagittal, along with the 3 axial plane basic screening. Apart from anatomical structural, fetal neurosonography should also include evaluation of convolutions of fetal brain which change throughout the gestation. Now this is very important. This is the area where the coronal section at frontal, this is coronal section at caudate nucleus, these are the caudate nucleus. This is corpus, the corpus callosum. This is cavum septum. And again, if you go below the transthalamic